An emerging reality of the COVID-19 pandemic is that most of the global population, including almost everyone living in the world's low and middle income countries (LMICs), lacks access to COVID-19 vaccines. A public health and global security crisis is unfolding as new variants of concern accelerate in Africa, Latin America and the poorest nations of Asia. The cases and deaths will soon increase. Ultimately, this situation represents a failure to create a system in which new vaccines for pandemic threats could be developed and produced locally, and designed specifically for use in resource-depleted health systems. The fact that no new vaccines are made in Africa or in many other low- and middle-income countries reflects profound lapses in international science cooperation and diplomacy between wealthy and poor nations. This will soon have catastrophic consequences. Here is the current status: only a minuscule number of people have been vaccinated against COVID-19 in Sub-Saharan Africa, in some of the largest Southeast Asian countries, including Pakistan and the Philippines, and in many Latin American countries. So far, Africa is being vaccinated at around 1/50th the vaccination rate of North America, and that ratio is even lower if Morocco, where 5 million doses have been administered, were not included. South Africa has administered fewer than 140,000 doses so far. In contrast, more than 24 million doses have been given in Britain, which is not much larger in population. There are doubts that this situation might change anytime soon. Our ability to scale up production of the two mRNA vaccines from Moderna and Pfizer-BioNTech, or deliver them through complicated freezer chain requirements, means that they might not find widespread use in LMICs. So far, no African country, except Rwanda, has received any doses of mRNA vaccines. South Africa is the only African nation to receive the new Johnson & Johnson vaccine, and this is happening through a research study involving up to 500,000 healthcare workers in that country. 4 other nations are getting the AstraZeneca-Oxford vaccine. Sub-Saharan Africa in particular faces an imminent and potentially catastrophic loss of life from COVID-19. While African countries have done reasonably well, 100,000 reported deaths in Africa compared with the United States, 530,000 deaths, Europe, 850,000 deaths, or Brazil, 270,000 deaths, the emerging B.1.351 variant from South Africa may soon change this situation. COVID-19 is already accelerating in nearby southern Africa countries such as Malawi and Zimbabwe. The Institute of Health Metrics and Evaluation projects that the number of people who will lose their lives in sub-Saharan Africa from COVID-19 will more than double from January 1 to May 1, with numbers expected to climb from there. Tragically, we do not have many vaccine options. The AstraZeneca-Oxford vaccine offers very low protection against the B.